Postnatal psychosis, also known as postpartum psychosis, is a rare but severe mental health condition that can occur after childbirth. It affects approximately 1 to 2 in every 1,000 women who give birth and is considered a medical emergency due to its rapid onset and potential for severe symptoms. This essay will explore the etiology, symptoms, risk factors, diagnosis, treatment, and impact of postnatal psychosis, providing a comprehensive understanding of this complex condition. Etiology of postnatal psychosis. The exact cause of postnatal psychosis is not well understood, but it is believed to result from a combination of genetic, biological, and environmental factors. Genetic factors. There is evidence to suggest that genetic predisposition plays a role in the development of postnatal psychosis. Women with a family history of mental health disorders, particularly bipolar disorder or schizophrenia, are at a higher risk. Studies have shown that the risk of developing postnatal psychosis is significantly higher in women who have a first-degree relative, such as a mother or sister, with the condition. Hormonal changes. The hormonal fluctuations that occur after childbirth are thought to contribute significantly to the onset of postnatal psychosis. During pregnancy, levels of estrogen and progesterone are high, but they drop rapidly after delivery. This abrupt hormonal change can affect neurotransmitter systems in the brain, potentially triggering psychotic symptoms in susceptible women. Sleep deprivation. The postpartum period is often characterized by significant sleep disruption, which can exacerbate or trigger mental health issues. Sleep deprivation can affect mood regulation and cognitive function, potentially contributing to the onset of postnatal psychosis. Stress and environmental factors. The stress associated with childbirth and the transition to motherhood can also play a role. Women who experience significant stressors, such as relationship difficulties, lack of social support, or financial problems, are at an increased risk. Additionally, a traumatic childbirth experience can contribute to the development of postnatal psychosis. Symptoms of postnatal psychosis. The symptoms of postnatal psychosis are varied and can include both mood disturbances and psychotic symptoms. The onset is typically rapid, usually within the first 2 weeks after childbirth, but it can occur anytime within the first few months. Mood symptoms. Women with postnatal psychosis may experience extreme mood swings, ranging from severe depression to manic episodes. Symptoms of depression can include persistent sadness, feelings of hopelessness, and a lack of interest in activities that were previously enjoyable. Manic symptoms may include elevated mood, increased energy, and erratic or impulsive behavior. Psychotic symptoms. Psychotic symptoms are a hallmark of postnatal psychosis and can include delusions, false beliefs, and hallucinations, seeing or hearing things that are not there. Common delusions may involve beliefs about the baby, such as thinking the baby is possessed or that the mother has special powers or a unique mission related to the baby. Hallucinations can be auditory, visual, or tactile. Cognitive symptoms. Cognitive symptoms such as confusion, disorganized thinking, and difficulty concentrating are also common. Women with postnatal psychosis may have trouble organizing their thoughts, making decisions, or remembering things. Behavioral symptoms. Behavioral changes can include agitation, restlessness, and erratic behavior. Women with postnatal psychosis may exhibit unusual or dangerous behavior, such as attempting to harm themselves or the baby. Risk factors for postnatal psychosis. Several factors can increase the risk of developing postnatal psychosis. These risk factors can be broadly categorized into biological, psychological, and social factors. Biological risk factors. History of bipolar disorder or schizophrenia. Women with a personal history of bipolar disorder or schizophrenia are at a significantly higher risk of developing postnatal psychosis. Family history. A family history of postnatal psychosis or other severe mental health disorders increases the risk. Hormonal sensitivity. Some women may have a heightened sensitivity to hormonal changes, making them more susceptible to postnatal psychosis. Psychological risk factors. Previous postnatal psychosis. Women who have experienced postnatal psychosis after a previous pregnancy are at a high risk of recurrence. Severe anxiety or depression. A history of severe anxiety or depression can increase the likelihood of developing postnatal psychosis. Social risk factors. Lack of social support. Women who lack a strong support system from family and friends are at a higher risk. Stressful life events. Significant stressors, such as relationship problems, financial difficulties, or traumatic experiences, can increase the risk. Young maternal age. Younger mothers, particularly teenagers, may be at a higher risk due to a lack of emotional and social support. Diagnosis of postnatal psychosis. Diagnosing postnatal psychosis involves a comprehensive evaluation by a mental health professional. This typically includes a detailed medical and psychiatric history, a physical examination, and a series of psychological assessments. Medical and psychiatric history. The clinician will take a detailed history of the woman's mental health, including any previous episodes of mental illness, family history of psychiatric conditions, and any symptoms experienced during pregnancy or after childbirth. This history helps identify any underlying risk factors and informs the diagnosis. Physical examination. A physical examination is conducted to rule out any medical conditions that might be contributing to the symptoms. This can include blood tests to check for hormonal imbalances or other metabolic issues. Psychological assessments. Psychological assessments involve standardized questionnaires and interviews to evaluate the severity and nature of the symptoms. These assessments help determine the presence of mood disturbances, psychotic symptoms, and cognitive impairments. Treatment of postnatal psychosis. Postnatal psychosis requires prompt and comprehensive treatment due to the potential severity of the condition. Treatment typically involves a combination of medication, psychotherapy, and social support. Medication. Medication is often necessary to stabilize mood and manage psychotic symptoms. The types of medication used can include antipsychotics. These medications help reduce psychotic symptoms such as delusions and hallucinations. Commonly used antipsychotics include olanzapine, risperidone, and quetiapine. Mood stabilizers such as lithium or valproate can help manage mood swings and prevent manic or depressive episodes. Antidepressants. In some cases, antidepressants may be prescribed to manage depressive symptoms. Selective serotonin reuptake inhibitors, SSRIs, are commonly used. Psychotherapy. Psychotherapy can be an essential component of treatment, providing emotional support and helping women develop coping strategies. Types of psychotherapy that may be beneficial include cognitive behavioral therapy, CBT. CBT helps women identify and change negative thought patterns and behaviors that contribute to their symptoms. Interpersonal therapy, IPT. IPT focuses on improving communication and relationships, which can be particularly important for new mothers. Family therapy. Family therapy involves the woman's partner and family members, providing education about the condition and improving family support. Social support. Social support is crucial for women with postnatal psychosis. This can include support from family, friends, and community resources. Support groups for new mothers or women with postpartum mental health issues can provide valuable peer support. Impact of postnatal psychosis. Postnatal psychosis can have a profound impact on the woman, her baby, and her family. The condition can affect the mother's ability to care for herself and her baby, and it can strain relationships with partners and family members. Impact on the mother. Women with postnatal psychosis may experience significant distress and impairment in their daily functioning. The condition can affect their ability to bond with their baby, which can have long-term implications for both the mother and the child. Women may also experience feelings of guilt, shame, and isolation due to their symptoms. Impact on the baby. The baby can be affected by the mother's condition in several ways. If the mother is unable to care for the baby adequately, this can impact the baby's physical and emotional development. Early bonding and attachment are crucial for the baby's development, and disruptions in this process can have long-term effects. Impact on the family. Postnatal psychosis can place a significant strain on family relationships. Partners and family members may struggle to understand the condition and how to support the mother. They may also experience their own emotional distress and feel overwhelmed by the demands of caring for both the mother and the baby. Conclusion. Postnatal psychosis is a serious and complex condition that requires prompt recognition and comprehensive treatment. Understanding the etiology, symptoms, risk factors, diagnosis, treatment, and impact of postnatal psychosis is essential for providing effective care and support to affected women and their families. With appropriate treatment and support, women with postnatal psychosis can recover and go on to lead healthy and fulfilling lives. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.